Hi, everyone. Thank you so much for joining us. I'm Gemma Lolos, Director of Marketing at Derive Technologies. Today, we're talking about something we hear about constantly from healthcare organizations, especially on the nursing side, which is documentation burden. Not just the time it takes, but how deeply it interrupts patient care and significantly contributes to nursing workload and burnout. At Derive, we work closely with healthcare organizations, as well as partners like Ava and Zebra, to help bring more efficient, clinician friendly workflows into real environments. I'm joined by Tara Brown from Derive, who's a business development manager and healthcare subject matter expert with over 15 years of bedside experience as a registered nurse, and Sarah Visker, nurse executive at Aiva Health, who brings both her clinical and product perspective to the discussion today. Tara, when you think about a typical nursing shift, where does documentation really start to become a problem?
For me personally, I felt like everything started to fall apart by like 10 a.m. or what we call the morning med pass. You get in, you get your assignment, you're trying to get your medications together, get to know your patients. And all it takes is for one thing to happen, somebody go to surgery, a code, an emergency, something to get you out of the workflow. And then before you know it, you're just behind. It's hard to keep up. If we don't chart it, it didn't happen. The accountability that we're kept to in terms of like legalities. You can go back to our chart, look at the time that we charted, and we're just held accountable to that. And that's all you have to go on if you find yourself in the legal situation in 5 years.
Let's talk about what a better approach actually looks like. Sarah, can you walk us through what AVA is and how it fits into a nursing workflow?
Yeah, so like Tara kind of called it out perfectly. Nursing has a really unrealistic burden put on them with all they have to do. We became nurses because we care about patients. We want to be there with patients, but we've been given this huge administrative burden with documentation. Sometimes it's upwards of 800 data points in a 12-hour shift that we have to do. What Ava is, it's an AI powered voice assistant made specifically for nurses, working directly with direct care nurses to help develop it. And the goal is to really empower nurses and improve patient experience by reducing that administrative burden. A huge part of that, like we said, is documentation. But then we have all of these other different technologies that nursing has to interact with on a day-to-day basis. So thinking of pulling in a video interpreter, entering service requests, having to do all searching policies and procedures to get that information to the point of care. We try to put that under a single interface so that nursing can just use their voice and get stuff right at the point of care where they need it.
Yeah, like she said, all this can be happen simultaneously. You're having to look up a procedure while you have to find a translator while the doctor's on the floor giving orders. So with four, five, six patients sometimes, all of this has happened simultaneously. And then that's how you
Wow.
fall behind.
That administrative burden with documentation too is just a real pain point. So like I said, upwards of 800 data points. Nursing is a lot of times spending 25 to 40% of their time in the EHR. So one of the key ways that we help nurses is by voice enabling that documentation. So our provider friends have been able to have this for a long time because their notes are unstructured data. Nursing documentation is almost like an Excel spreadsheet of hundreds of clicks and drop downs of structured data points. So it took a little bit to get the AI to the level to be able to understand all of that structured data. So now nursing can just speak their documentation. The AI tools will parse it into all of those 800 plus rows that it might have to go into. Nursing then can validate it mobily at the bedside and not even have to touch a computer. So it's really improving efficiency for nurses.
Wow. That's incredible. The details, Sarah, that you're going into, it sounds like normally adoption tends to be an issue with a new technology, but it seems like where Ava's concerned, that's less of an issue.
Yeah, and we have a couple different approaches for this. So, number one, as soon as we partner with an organization, working with if you have a nursing informatics council or getting together a nursing informatics council of direct care nurses that have a voice in what workflows are your biggest pain points that we want to voice enable. So, making the nurses the owners and the designers of their experience from the very beginning is a really important part. And then, because of that work that we've done in the front end of having nurses be the builders of this and the designers of this, it matches their workflow. So we're asking the technology to support nursing workflow versus asking nurses to bend to technology. We're not saying you have to talk in flow sheet speak to make this work. You can talk naturally as nurses would talk to make it work. So we're seeing really good adoption. At some sites, we're seeing that up to 20% of the flow sheet documentation is gone now through voice within the first 48 hours of going live.
And once adoption happens, that's, I think, where we really start to see the broader impact. It's less time spent catching up on charting, reduced overtime, less strain on both staff and the organization. Sarah, can you walk us through what this actually looks like in practice? A little bit of a demo, if you will?
Yeah, sure. And Tara kind of outlined it. It's like all of these things will happen at once, right? I might be coming into a patient room and they don't speak English. I can say, call the Polish interpreter. And instead of having to run down the hall and get an iPad on a stick that's shared between all of the rooms on the unit, I can have right in my pocket my video translator. Then we can talk through our assessments. I could start to do my nursing intake by just pressing my microphone and it'll start to say, are you having any pain today? They'll tell me their assessment back to me. We can capture it both ambiently or a nurse doing more of a dictation if that's more appropriate, depending on the clinical setting. And from there, if I had a question, I could say, how often do I need to check NG tubes? Instead of having to search a 17-page policy and read through to page 5 to find my answer, it'll just give me a one-liner of saying, you need to check it every 4 hours, and then a couple bullet points of important information, and then give me the source of the entire policy if I need it. If you have your own policies and procedures, we can pull those in and interface with your organization's policies and procedures, but also if you use a tool like Lippincott or Elsevier, we can also partner with them. Even pulling in procedure checklists and videos if they have them.
It saves so much time.
Yeah, and just getting that information at the point of care, right? So one thing comes to mind, being a float nurse, if you're a seasoned cardiac nurse, external pacer wires, they're no big deal, right? You take care of them all the time. I was a float nurse at night one time. There's no educator around, and I had a patient with external pacer wires, and I had no idea what to do with them. I've never seen them in real life. I heard about them in nursing school. So I literally printed off a policy and printed off a care plan and carried it around with me and was fumbling through it all night trying to figure out how to take care of this. It's one of those things I wish I had when I was a direct care nurse for sure. And then the service requests too. I could walk into a room and the computer is broken. I could just say, hey, the computer in room 302 is broken, enter a service request for me. And it could just make it go by magic, right? So if you use like ServiceNow or whatever ticketing management system that your organization uses.
Well, I mean, we didn't even touch on, you have a 12-hour shift. It's really 13 by the time you get there, get report. And then you have an hour, sometimes 2 hours, you're staying over to chart, and it's literally clicking boxes. So second amount of overtime this saves hospitals.
And number one, that's the time where I'm supposed to be going home and having my recharge time in between shifts with my family. And then the box checking, I've had nurses described it to me as being literally soul crushing. And it's because you have this list to keep up with that you're trying your hardest. Like our nurses, we're the most trusted profession. And I'm sorry, I'm going to just get so nursey because it's Nurses Week too. We're the most trusted profession and everyone's trying to do the right thing. And I'm checking all these boxes. I'm trying to make it complete. I'm not giving my patient the face time and care that I want to give because I'm managing these boxes. And then I go home late. I didn't get that time with my family. I come in the next day to have someone from compliance to tell me you missed 3 boxes. Like when you're already trying your hardest and not able to keep up. So it's something that's so needed. And we see nurses kind of leaving in droves and we need them there, right? They're the people who care and they want to be there if we can give them the right tools. So just really supporting them and trying to bring the joy back to nursing, taking it back to the art of nursing and not turning it into the checklist of nursing.
For sure. And, speaking of getting nurses access to great tools, how does something like this get actually implemented into a real nursing environment? Where does an organization typically start?
If you're a nurse listening to this, I would definitely go to whoever's the champion at your hospital for patient care, nurse and nurse advocacy. Have these conversations, get Derive involved in these conversations. We definitely can pilot it. And then I'll let Sarah get into the more technical side of how, but just make a decision that you want better patient care and you want to protect your nurses and you want to start having these conversations. So I'd say on that end, definitely engage us, engage Derive.
Yeah, from an implementation standpoint, this is generally about an 8 to 12 week project that will involve different teams at different phases, right? So we're very cognizant of this is not the only thing that organizations are working on. There's a lot of priorities. So making sure that you're engaging the right teams at the right time. What it will look like first is I like to come on site and actually spend some time with the nurses, do some shadowing and finding where their pain points are and making sure that we're voice enabling and giving them the efficiencies where they're really going to feel it the most. There's a lot of things that we can do, but really prioritizing the way it's going to make a difference. Like we don't want to implement AI tools just because it's fancy and we want new technology. We want to actually move the mark for our nurses and our patients. From there, we'll go on to scoping and workflow meetings to make sure that we're mapping out the workflows. And then we're able to work with the EHR teams to get an export of all of their flow sheet documentation or other tools that they want integrated. And we're able to set up the interfaces where we would at that point engage the interface team to do all of the mapping and make all the magic work behind the scenes. From there, we're able to do testing. We use AI to automate a lot of the testing on our end, but then we work to make sure that all of the mappings are correct with that organization. And then a really important part is workflow testing, where we have the nurses go out and do some shadow documentation. And anywhere you go, there's going to be some local ways or organizational ways of saying something, and we want to capture all of those ahead of time. Those are really easy to fix. We can put synonyms in. One example is an organization for their incentive spirometry. They called it TriFlow, which is a brand name, and the AI tool didn't know what to do with that. But in our testing, we found that, so we were able to put in a synonym, and now the nurse could speak the way they would speak, and we don't have to make them bend to the tool, right? At that point, then it's actually very easy to use. It's a single button interface, so not that much training is needed. I'll say more so the go live support of giving people the invitation to try it. If someone might be hesitant to say, just try one row, let's do one assessment together. And at that point, once they see how easy it is, they usually just go for it.
Sounds like you're very supportive as an organization. You're hands-on, you're out on the floor with the nurses. As a former nurse, you know exactly what they're looking for and what they need. I think that's great.
Yeah, it's really important to me to make sure that we're listening to the voice of the nurse and your nurses seeing that you are listening to them and taking their advice and doing what they're asking to do is actually more important than the tools that you provide them. Obviously, we want to provide them also the best tools possible, but if you don't listen to the voice of the nurse, then it's almost like they feel like technology is being done to them versus something that supports them, right? So we want to make sure that we're in lockstep alignment with them and what they want to see their care and practice look like to make sure that they have the tools that they feel like are actually going to work for them.
Can you speak a little bit to how Aiva works really well with Zebra? Zebra is another major partner of ours.
I've talked a lot to their CNIO, Cassandra, and she will host work groups and have the nurses on the floor give feedback to the actual design, the weight, making sure it doesn't pull down your scrubs when it's in your pocket. The real practical things that are meaningful to nurses like that. And then they also have the badge, which is really great. You take your Zebra device and you literally just tap it and it pairs. You could put the badge on and then you could have a truly hands-free experience. So there's a wake word, you would say, hey, Zebra, and then you could just rattle off your assessment and do it completely hands-free. You could actually have your hands on the patient as you're doing the assessment to be able to rattle it off. And thinking of use cases such as a patient who's in an isolation room. I have my phone in my pocket. I'm donning my PPE. I can do hands-free documentation. When I come out, I take off my PPE. I can validate it's the right documentation on the right patient and send it right to the record. Other great use cases are in the OR. We've seen circulating nurses want to use it where you have to maintain sterility to do things like their timeouts or to do those timestamps of wheels in, incision start, incision closure. Those timestamps are really important to OR throughput. So we're seeing those nurses do that hands-free technology being really important to them.
I'm a huge fan of the badge. I'm a big champion of nurse safety and patient safety. I mean, nursing is the most assaulted profession out there.
Yeah.
I've been assaulted over 100 times myself and even attacked by a dog in a patient room. The ability to have that panic button, the hands-free communication. So when a situation arises, you do everything more effectively and efficiently, right? And sometimes every second matters. So
Yeah.
I think the Zebra badge, I'm just a huge fan of, and the fact that it pairs with Aiva for hands-free documentation and communication, I think could literally save lives.
On the back of the phone and on the badge, there's the duress button. Yeah, same. I was out of work for 2 months after being assaulted by a patient one time. And unfortunately, Tara and my experience is not unique. And it's happening more and more. There's also a duress word that you can say as well that I know the Zebra team put a lot of time and effort into it because it has to be a word that is easy to pronounce. It can be picked up with different accents. that it's not commonly used, and that was 3 syllables. So they picked this duress word that you're able to use too, that you can kind of say a secret word and also get the help to you right when you need it. And they have a new fancy freestanding badge that Cassandra showed me during HIMSS. And that one actually has a body cam too, that when you say the duress word, the body cam turns on so that you can actually have footage of what's happening. And I think every nurse should have that.
Sarah and Tara, when Aiva is implemented into nursing workflows, what would you say is the biggest change from a nursing perspective?
I would imagine the nurses are happier, the patients are happier. Something we haven't touched on yet is patient satisfaction scores and how that literally dictates and looms kind of over us in the background. So we see patient satisfaction scores go up, the patients have a better experience and they have better outcomes.
Yeah, and we're actually even seeing that outlined in the data. So we have one organization that tracked their patient experience outcomes through their implementation. And for those nurse sensitive questions, so like my nurse was responsive to my needs, they saw a 35 to 40% increase in those 6 nurse sensitive questions. And their hypothesis behind that is that number 1, as a nurse, I'm having more direct FaceTime with my patient. And number 2, because I'm voicing those assessments out loud, the patients are up to date with what's going on, have the opportunity to ask questions, and I'm starting those conversations earlier. And we're also seeing one of the CNAs, because also this tool can work for your nursing assistants as well. She was telling me I'm saving an hour per shift with this tool. And I was rounding with one of her nurse leaders, and one of her nurse leaders says, "That's really great. Like, what are you doing with that hour?" And she said, "I was able to give my patients the real bath, like the good bath this shift." And that almost brought tears to my eyes, because I remember being a caregiver and having to go through and kind of give the PM care in a rush versus the night that you had the time and you gave them the spa treatment right before bed, and how you felt better leaving and you felt like you treated your patients like a human being, right? And the way you would want to treat you and your family. So being able to give the clinicians that back, I feel like that brings back the joy of nursing and the reason why we all became nurses. So the time savings definitely translate to hopefully more bringing back the joy of nursing. And like you said, improving the patient experience and feeling more cared for.
Yeah, I think at the end of the day, that's what this is all about. This is about reducing administrative burden, supporting nurses, most importantly, allowing them to stay focused on what matters most, which is patient care. And at Derive, we spend a lot of time helping organizations not just evaluate solutions like this, but actually implement them and operationalize them in a way that sticks. So thank you both, Sarah and Tara, for this conversation. Thank you to everyone who joined us. If you're interested in learning more, we'd love to connect. And this recording will be sent out to everyone. Thanks so much, guys.